So let's consider the question, does chlorhexidine bathing prevent hospital-acquired infections in critically ill patients? I've broken this down using the PICO framework. So we have our patient or population, which is critically ill. We have our intervention, which is chlorhexidine. And we have our outcome, which is hospital-acquired infections. The comparator is implicit in this case. We're not going to compare to a different intervention. We're just going to compare to lack of chlorhexidine bathing standard of care. Sometimes it makes sense to include that in the search, but in this instance, we're just going to ignore the comparator. So what we're going to do is develop a search strategy for each of these components, and then we'll combine them together. So let's start with our patient population. Okay, so we start by going to the Kornhauser website, library.louisville.edu/Kornhauser. And the reason that we do that is so that if, when we're searching, we come across a resource that we have access to as members of the university, we are prompted for our login credentials, we can get in and we can get access to it. So always start at the Kornhauser website. Go to top links and click on PubMed. So let's look for critically ill. Now we could just type in critically ill, but we're going to be more targeted than that. The first tool we're going to use is the MESH database, which is down here under Explore. MESH, or medical subject headings, is the NLM, National Library of Medicine, controlled vocabulary thesaurus used for indexing articles for PubMed. What does that mean? It means that the National Library of Medicine maintains a specific vocabulary that it uses to refer to specific concepts. So in this case, critically ill could be referred to as critically ill, it could be referred to as critical illness, it could be referred to as high dependency, it could be referred to as all kinds of different things. There are lots of different synonyms for single concept. The idea of controlled vocabulary is to have one term that applies to one concept so that you don't have to account for all of the different ways that it could be phrased. So for example, if we type critically ill, we get a page called critical illness. This is the term that the NLM uses to refer to a disease or state in which death is possible or imminent. This is a definition, or a scope note is the librarian's term. You have your entry terms down here. These are all terms that if you type them in here, you will end up at this page. So we typed in critically ill, that's how we ended up here. Now if we add this to Search Builder, it fills in the syntax for us. So it has critical illness, which is the term, in double quotes, and then MESH in brackets afterwards. So this specifies that we're looking for this phrase and we're looking for it as a MESH term. So if an article has been indexed by the National Library of Medicine and they have determined that it relates to critical illness, they will add that to its list of MESH terms, and then when we run this search, it will show up in the search results. So if we click Search PubMed, and we get 41,000 results. Now, unfortunately, this isn't enough. Controlled vocabulary by itself isn't sufficient. It excludes a lot of things, partly because not all articles in PubMed are given MESH terms, and partly because indexes are not perfect, mistakes happen, and not every article gets all the MESH terms that it necessarily should. Reasonable minds can differ, so using MESH is great, but we also need to use keywords. And quantitative studies have consistently shown that neither controlled vocabulary nor keyword searching is as effective by itself as a combination of the two. So we're going to combine the two. How do we combine, and what do we combine with? We go to the advanced search. This is the advanced search interface. So you have your query box here where you write in what you want to search for, and then the searches you run will appear in a table here. But so what we want to do is have our MESH term and then say OR. OR is a Boolean operator, which is a fancy way of saying it will join words together in a specific way, or join terms together in a specific way. What it's going to do is say we're looking for things that have critical illness as a MESH term, or critical illness anywhere in its metadata. Now we could narrow this down. We could say that we want to look specifically in the title and abstract. So we could type title / abstract, or the shorthand is TIAB. You may want to do that if you're getting loads of results and you're having difficulty narrowing it down. But to start with, we're not going to have anything in brackets. We're just going to search it as a phrase. And that means that PubMed will look in every metadata field to see if that phrase appears. Now we can have as many synonyms as we can think of, and the more you have, the more you're going to match. The more times you use or, the greater the number of results you're going to get. So we have critical illness as a keyword, or critically ill. Capitalization does not matter. And then if we run this, we get twice as many results by including those keywords. Now, you may not look at a number like 41,000 and think, I need another 40,000 of those. But once we start combining multiple different components of this search, the numbers are going to drastically go down. So no matter how discouraging this looks right now, you actually want to get as many as possible when you run these individual searches. And then once you start combining them, they're going to narrow down. So we've got critical illness as a mesh term, critical illness as a keyword, critically ill as a keyword. But we can do a bit better than that. Let's go back to PubMed, the mesh database. Now we had critical illness. What else can we search for to find patients who are critically ill? Where do we find patients that are critically ill? Critical care. Now, notice this time it didn't take us to one specific page. It took us to a list because there are multiple terms that might be relevant. Now, critical pathways, that's not what we're looking for. Acute care surgery, that's too specific. We're not just interested in surgical patients. Critical care outcomes sounds relevant, but if we look, a measure of the mortality and morbidity rates among patients who receive critical care and intensive care as determined from the date of hospital discharge or release. Now, our outcome is hospital-acquired infection, which by definition is not going to be after hospital discharge or release. So this is not in fact relevant. Critical care nursing is relevant. Critical care is relevant. Now, when we add to Search Builder, because we've got multiple terms, we're going to say add with or, add to Search Builder, and then it will fill in the syntax for us. So critical care nursing as a mesh term or critical care as a mesh term. Now we can leave this here, find critical illness again, add with or, and again, we're using or because these are synonyms. These are all referring to, roughly speaking, the same topic. They're slightly different, which is why they're different terms. But all of these are going to be relevant to our patient, which is the critically ill. So we join them with or because we'd be happy to match records that are marked as critical care nursing, or that are marked as critical care, or that are marked as critical illness, or any combination of the above. That's why we use or. It will fill in these parentheses automatically. This is an extremely annoying thing that lots of search interfaces do. Just get rid of them. They won't cause a problem as they currently are, but once you start to combine lots of different terms, you end up with a bunch of unnecessary parentheses and things get confusing very quickly and you can make mistakes. You don't need them, just delete them. Search PubMed. Go back to our advanced search, and then we've got 104,000 results. Now if we copy this, so we have all of our mesh terms, and then we add in our synonyms. So we had each of these as a keyword. But notice critical care, nursing, and critical care. If we search for critical care as a key term, anything that says critical care nursing as that exact phrase will be matched by just critical care. So we don't need to include both. We can say or critical care. And if it says critical care nursing in the title, the abstract, whatever, it will match using this. So we don't need to specifically say critical care nursing as well. Now we can add in or critical illness as a keyword like we did before. What are the synonyms? Where can we find other synonyms? Well, notice if we go back to the mesh database, we search for critical illness. We have our entry terms down here. Now, as I said, these are the terms that if you type them in here, you'll end up at this page. However, they're also synonyms. So they're also words you can use as keywords. So we have critical illness, critically ill. We have critical illnesses. Don't worry about the commas. We don't need to include the ones where they've just rearranged the order of the words with commas, because that's not how they're typically going to be referred to in the literature. But we want to include critical illness. We also want to include critically ill and critical illnesses, plural. Now we can type all of those in individually, or we can cheat. So if we say critical illness and then put an asterisk, what that means is anything that comes after this up to the end of the word is fine. So it will match critical illness or critical illnesses will both be matched by illness asterisk. And then we can say or critically ill. What else could we try? What's another name for the place where we find critically ill patients? Intensive care. Now we've already got critical care nursing, intensive care units. Now if we look down here, this is the hierarchy of mesh terms. Further to the left, less deeply indented, is more broad, less specific. More deeply indented, further to the right, is more specific. And then under a given term, you have more specific terms that are subcategories of a given term. Now, the more specific, the better. So if we were just interested in respiratory care units, then that's what we would select. If we were just interested in pediatric ICUs, that's what we'd select. If we were just interested in neonatal ICUs, that's what we'd select. But that's not what our research question was, so we're not going to narrow it down further. Then we're going to add it to the search. Now, if we weren't interested in any of these, we only wanted stuff specifically marked as intensive care units, we could say do not include mesh terms found below this term in the mesh hierarchy. And then fill in the syntax so that it's not searching for burn units or coronary care units, it's just searching for things flagged as intensive care units. In this instance, there's nothing wrong with including any of these, so we're not going to do that. We're just going to add the mesh term by itself. If we check our entry terms, we've got intensive care unit or intensive care units. Now we can add in our keywords here as well if we want to. It's the same syntax here. So we can say or intensive care unit and then asterisk, so it covers units as well. And then search PubMed. Go back to our advanced search. Oh, whoops, we're in a new tab. Copy this. Back to our advanced search. Or paste. Now when we add this to our history, we get 500,000 results. Again, these are horrifyingly high numbers. We don't want 500,000 results, but these numbers are going to drastically decrease once we start adding in the other components of our search. So don't worry. So let's tidy up a bit. Select this and copy it. Put it somewhere for safekeeping, in a Word document or something like that. The reason for that is that this interface will eventually clear itself, and you might lose the progress that you've made. So always keep a copy on your computer of the searches that you run. You may need to refer to them 3 months down the line. You may want to go back and edit them. You may want to do any number of things. Always keep a record of the searches that you've run. If you want to capture everything in this table, you could just click download and you'll get a CSV file, which can be opened in Microsoft Excel or Google Sheets or whatever, which will include this entire interface. So we'll have the search number, the details, the query, when it was run, the number of results, and then you can just copy this back in. But what I've done for now, because this is just the one search, these are all things we tried earlier that weren't as good as this. We only want to keep this one, so I'm just copying that and pasting it in a document. And then I'm going to delete all of them. Let's go to our next section. Intervention, chlorhexidine. Go back to the home page and then to the mesh database. We're going to search for chlorhexidine. Got our scope note, a disinfectant and topical anti-infective agent used also as mouthwash to prevent oral plaque. If we scroll down, we've got our many synonyms, lots of different names. Drugs often have many different names. So what we're going to do is say add to search builder. And then we're going to add in all of these as potential keywords. So, or chlorhexidine. Now, notice we want to include the term itself as a keyword. And that term appears in chlorhexidine acetate and chlorhexidine hydrochloride. So if we search for chlorhexidine and there's something that mentions chlorhexidine acetate or mentions chlorhexidine hydrochloride, it will show up. So we don't need to include all three of those. Chlorhexidine will cover it. We do want to include tubilicid or Sebedin A or Novalsan or MK412A or MK412A with no hyphen or MK space 412A. Search PubMed. We have an alert. Quoted phrases not found in phrase index. Sebedin A, Novalsan, MK-412A, MK412A, MK space 412A. None of those showed up. So we need to remove them from the results. If we go to advanced, or from the search, excuse me. We go to advanced. Again, we have highlighted here the ones that didn't actually show up. So we want to remove these from the search because otherwise they're going to do all kinds of weird things. If we look at what this is translated into behind the scenes, we can see that it couldn't find MK space 412A. So now it's searching MK in any field and 412A in any field. Well, we don't want to do that because MK could be someone's initials and 412A could be the address of a research facility. So we don't want to search for that. We wanted to search for these specific terms, but if they don't show up, they don't show up. So we're going to rerun the search, just removing all of the ones that are highlighted in red. So we're going to take chlorhexidine or tubilicid, copy it, put it in here, and add it to history. Now, in this instance, we have the exact same number of results, but this could have matched something weird. So good practice is anytime you get an alert like this, remove the ones that are highlighted in red so that your search isn't doing anything unexpected behind the scenes. Delete that because we don't need that. And that's our search for chlorhexidine. Copy it, put it somewhere for safekeeping. Okay, one more, our outcome. Hospital-acquired infection. Same deal, go to PubMed, mesh database. Hospital-acquired infection. Cross-infection. Any infection which a patient contracts in a healthcare institution. Great. Add to search builder. Now let's look at the entry terms. We have health space care associated infection, healthcare associated infection. And these are pluralized as well. Cross infection, pluralized. Hospital infection, nosocomial infection, and plural. So again, we can use the wildcard to help us. The wildcard being the asterisk. So we can say or health care associated infection asterisk, so it will match infection and infections. But we can go further still. We can say health asterisk care associated infections, so that will match healthcare as one word like that, or with the lowercase c, again case doesn't matter, or it will match health space care. The asterisk will cover both of those. What else do we have? or hospital infection asterisk. We have cross-infection as a keyword asterisk. We have nosocomial infection asterisk. We have our original search, hospital acquired infection asterisk. Now we could have hospital space acquired, hospital hyphen acquired. Hyphens will be ignored. If it's hospital space acquired or hospital hyphen acquired, it will match. So don't worry about the hyphen. Search. Get back to our advanced interface. And there's our outcome search. Copy and put it in the same document. Again, always keep a record of your searches on your computer, not in this interface. Don't rely on this interface to preserve it for you. It will disappear eventually. So let's start fresh. We're going to combine these three, and each row of this table, not the comparator because we're ignoring it, but each of these three rows will correspond to a row in the table that appears here. So we start with our patient or population, which is the critically ill. Copy our search in, click add to history, and then we stay on the same page, but it appears down here. Chlorhexidine, add to history. And finally, cross-infection, add to history. Now these numbers are enormous, but what we're going to do is combine these not with or, but with and. Within each row, we're combining with or, because these are synonyms for the same concept. We'd be happy to match something that talks about chlorhexidine, or that talks about tubulacid, or both. That's why we combine with or. The other Boolean operator that we use is and we use to combine vertically these different rows of this table, because we're not interested in stuff that's to do with critical care nursing or to do with chlorhexidine or to do with cross-infection. We're interested in stuff that is to do with critical care and is to do with chlorhexidine and is to do with cross-infection. So we combine them with and. The way we do that in the PubMed interface is to reference them by number. So you have this search column here that gives you the numbers of the searches. So you say number 1 and number 2 and number 3. And add to history. 523. Still a lot, but a lot more manageable than 1,000 times that many. So how can we narrow this down? Well, let's have a look at what the results were. Oral hygiene care for critically ill patients to prevent ventilator-associated pneumonia. That's weird. We're not interested in oral hygiene. Healthcare-associated infections, that's fine, potentially. Intensive care unit, acquired pneumonia. Oral hygiene again. Daily bathing, that's better. So one thing we can do in order to make our search more specific, we're not just interested in chlorhexidine, we're interested in chlorhexidine bathing specifically. Let's look at this. Scroll down. Here's the list of mesh terms that are applied to this specific article. Baths is one that we haven't included in our search so far. So let's try that. We go back to the advanced interface. Baths, this mesh term, or bath asterisk. Now that will cover bath, it will cover baths, and it will cover bathing. Add to history. So what we want to do for this revised search is we're still treating this as our patient and this is our outcome, but our intervention is going to be a combination of chlorhexidine and bathing. So what we actually want is 1 and 2 and 5 and 3. Now these parentheses are not actually necessary in this instance, because all of the operators are and, so they're going to be joined together the same way anyway. The order doesn't matter, the parentheses don't matter. But in terms of how we think about what we're doing here, we're searching for our patient, which is 1, our intervention, which is a combination of 2 and 5, and then our outcome, which is number 3. But we could put 1 and 2 and 3 and 5, and we get the same result. Add to history. 154. Again, still a lot, but we've narrowed it down to about a quarter of what it was. Now, the best way to narrow things down is to revise the search strings that you use. So if you can think of more edits you could make to make this more specific, you can do that. However, at some point, we just got to go to look at our results and then use the other tools available to us. So to start with, here's a bar chart showing how many results per year. Notice the results go all the way back to 2005. It is perfectly reasonable, as a means to narrow down a large number of results, to narrow to the most recent 10 years or the most recent 5 years. Even under certain circumstances, the most recent 1 year. But for most projects, that's going to be a bit too narrow. But if we scroll down, we actually have these as options. So if we say narrow to the last 5 years, we're down to 47. This is getting to be the kind of number that we could reasonably read through ourselves, maybe as a team of a couple or 3. We could get through 47 articles without taking forever. What else can we do? We can narrow down to article type. Now, there are actually a lot more article types. If we look at additional filters, there are loads of them. Most of them are not particularly useful, but one that you might want to look at is clinical study, which will cover clinical research of all kinds. So not just clinical trials, but observational studies, quality improvement studies. So when you click show, it will appear here, and then you need to click it there. And it narrows it down to 12. These are very imprecise. Not everything that is a clinical study is marked as such. Not everything that's marked as a clinical study is, unfortunately. They're less reliable than mesh terms. So only use them if you need to. We might not want to in this instance, but it's a possibility. How else can we narrow things down? Sex might be relevant for certain topics, although you might be excluding a lot of information that's still usable. Most clinical studies will at some point stratify by sex. So even if your topic is specifically relating to outcomes in female patients, articles that have male patients as well may not be irrelevant. So be careful using those. Age, if you're interested specifically in adults or children or any of these other predefined categories, you may want to use these. They're not very precise, again, unfortunately, but if you have loads of results and you want to narrow it down, that might be one way of doing it if your research question is specifically relating to pediatric or adult patients. You may want to exclude preprints. Preprints are not peer-reviewed. The only ones that appear in PubMed are studies that have yet to be peer-reviewed but were funded by a specific set of funders, which is primarily government health agencies have agreements with PubMed Central to have the preprints that are derived from research they've funded appear in PubMed. But they're not peer-reviewed, so it's perfectly reasonable to exclude them. And you can narrow down by language. This is not ideal, but we don't live in an ideal world. If we're doing a big evidence synthesis project that's well funded, then potentially we could hire translators or whatever we may need to do. But in practice, for the vast majority of projects, you're only going to be able to deal with articles in languages that you speak. Now, if you speak Pashto, by all means, search for articles in Pashto as well. If you speak any of these languages, you'd be willing to read research articles in them, then you can include those languages as well. Or if, like me, you only speak English, then that's the only one that's going to be useful to you. You can narrow it down to articles that are available in English specifically. Do not filter by text availability. The reason for this is that if the text is not immediately available to you, we can probably still get it for you through Interlibrary Loan. So it's a bad reason to rule out articles. So don't use these filters. Just never, ever do it. So let's say we're happy with our 43 results. What do we do with them? Well, we want to save them. We don't want all results on this page because currently we're only showing 10. And we don't want to go all the way down until we're showing all 43. What we want to do instead is say all results. We don't want summary text, we want PubMed as the format, and create file. Now that downloads a plain text file which you can then drop into your citation manager. Hello there, future Alex here to reprimand my former self. I said in the video that if you wanted to cover both healthcare as one word and healthcare as two words, then you could simply put health asterisk care and the wildcard would take care of both of them. Looking at the results here, this is clearly not true. Um, if you want to cover both of these, you need to include them both separately in the search. Having just the asterisk is only going to cover healthcare as one word. It's not going to cover the two-word variant. So my mistake. If you want to include both in the search, make sure to include both in the search.